Hello, this is Dr. Roy Kim, and
Dr. Hillary Jenny.
So she's my special guest. She's visiting me from Johns Hopkins. She is a plastic surgery resident there, and we're going to talk a little about why you went into plastic surgery, what Johns Hopkins is like, as well as what your future plans are. So first of all, Dr. Hillary Jenny, thanks for joining us. So anyway, what got you interested in general back in college or med school to go into plastic surgery?
Yeah, for me, it was a little bit later. It was my third year of medical school. So I was doing my clinical rotations, and I just realized during my surgery rotation that I really loved surgery. And so I pivoted from my prior interest in OBGYN to being interested in surgery and specifically plastic surgery. So I just pursued it from there.
Great. So just in case you don't know, in the U.S., you do college, about 4 years, medical school for about 4 years, and then plastic surgery training. So for your plastic surgery training, you can apply to various institutions. Why do you want to go to Johns Hopkins?
For me, it's all about the people. I think I learn really well in a really collegial environment full of intellectually curious people who are continually trying to push the envelope. And that's what I really felt like I found at Johns Hopkins. So I fell in love with that on my interview day. I knew it was going to be my number one choice. Unfortunately, they felt the same way.
That's great. So what's training like at Johns Hopkins for plastic surgery?
Well, it's a lot of work. Surgical residency is a lot of work kind of no matter where you go, but it's important to be able to learn everything that you want to be able to learn, both in the OR and outside of the OR, caring for your patients on the floor, caring for your patients in clinic, and sort of taking patients through the whole workup through completion of their procedure and recovery. So there are work hour restrictions now that were enacted before I started residency. So we are limited to 80 hours of work a week. Sometimes we get very close to 80, but we don't actually exceed work hours at Hopkins. But it is typically, in the 70-hour per week range on average. And then on top of that, you may also have research that you're doing and other things that you're working on, including your own education. So it's a good bit of work, but you have to learn how to operate head to toe.
So when I trained, because I love talking about myself, they didn't have work hours. So like 80 hours a week, That's like a pretty good week for me.
Yep.
I was typically pushing 90 to 100 hours a week. So the good old days of every third night call, occasional, actually pretty rare every other night call. This is back in the 90s in the 20th century, so this is a long time ago.
Before color TV, right?
Yes, before color TV. It was black and white, and then we had like the magnifying screen to make the black and white screen look bigger. So that was really cool. Yeah. But yeah, I'm glad they have work hours. Mm-hmm. So one thing that you may not know for the viewers out there is like it's not Johns Hopkins, it's actually Johns Hopkins.
Johns Hopkins, yeah.
And the reason why is the dude's name is actually Johns because he was named after a relative. So it's not John. So the other thing that we talked about, which we know because we're surgeons, but you may not know, is the training of surgeons in America was really run by cocaine addicts. Is that correct?
It is true, yeah.
Yes.
Dr. Halstead, who sort of pioneered surgical residency training as we know it today, had a cocaine problem. So he became addicted to it when he was researching it on its use as a potential local anesthetic drug. And so he researched it, demonstrated it on himself, tried it on himself and his friends, and they all ended up becoming cocaine addicted. And actually a few of them, I think, passed away from their addiction. Dr. Halstead was shipped off to some rehab, and during the process of rehab, they put him on morphine, trying to control his stimulant addiction, and then he subsequently became addicted to morphine.
Yes, so then we looked up actually the amount of morphine he was on at his lowest point. So he was on 200 milligrams of morphine a day, sort of at the smallest amount. And just to let you know, how much morphine is in a typical pill?
We often give our patients 5 milligrams of oxycodone, and that's 7.5. So he was taking about 12 and a half every 2 hours. Would not recommend.
Yeah, so I guess the take-home point is it is possible to be a highly functional addict, I guess. But I think the real take-home point is that's a massive tolerance.
Huge tolerance, yeah. And that was the lowest he ever got to. So it seemed like he was able to wean it down to that point. So that was the nadir of his addiction.
Yeah, and so we can totally blame Dr. Halstead for the ridiculous work hours that we had. I mean, they call it residency because you're a resident at the hospital. Mm-hmm. The whole thinking at the time was that you had to see the disease process all the way through. So admitting the patient, seeing what the patient was like, operating on the patient, taking care of the patient afterward, the aftercare. So you can't go home. You got to stay at the hospital to see this whole thing. So, if you live at the hospital as a resident, it's no big deal. Just stay there for a couple months or a couple years. You're
just
okay.
Live there.
Yeah, and that's what people literally did. So I think that obviously with work rules, we can still create excellent surgeons without living there all the time.
Yes.
Yeah. And even though I trained in the 20th century, even I did not live at the hospital all the time. Like, I was allowed to leave the hospital once a month just to go home. It was nice of them.
Yeah, just to see some daylight.
Yeah, that's right.
Yeah, get your vitamin D.
So anyway, with plastic surgery, now you're interested in aesthetic plastic surgery.
Yeah.
So back when I trained, there weren't that many aesthetic surgery fellowships. Now there are a bunch. It's now formalized. If you could talk about how you got interested in aesthetics and what the process is like for applying.
Sure. Yeah. I mean, I think, when you enter plastic surgery residency, you're learning how to do initially primarily reconstructive surgery. And so you start off learning your general anatomy, learning your basic reconstructive procedures. And then as you kind of move on in residency, you get a little more exposure to aesthetic procedures. And the more exposure that I got to aesthetic procedures, the more I realized that I really found it interesting. So I think plastic surgery is all about addressing form and function, and you can think about that in a couple of different ways. It can be the function of your hand and your flexor tendon, or it can be the function that you get from feeling confident in your own body and feeling comfortable in your own skin. And to me, that's what I really resonated with, was being able to help people enhance what they like most about themselves and improve other things that really bother them. And so I just fell in love with aesthetic surgery's ability to do that.
So yes, you have to do plastic surgery training, and then you apply, I believe, 1.5 years in advance.
Yes, yeah.
Yeah. So you're in the middle of that process now.
In the middle now. I just submitted today.
Yeah. So that's great. And then the fellowship is classically about 1 year long. Is that correct? Yeah.
Yeah. The formal fellowships are 1 year, and it does go through the match process. So it's the same type of process as applying to residency, just on a smaller scale, as there's fewer fellowships, fewer people applying, but it is still a formal match process. You apply, you interview, you submit a rank list, and I'll find out on my match day.
That's great.
Yeah.
Well, congratulations on applying. That'll be fun. Congratulations on finishing up at Hopkins soon.
Soon, yep.
Yeah. Do you have any questions for me?
No, thank you so much for letting me watch you and watch you do your work.
Oh, well, thanks.
Yeah.
So if you have any other questions, please leave them in the comments or the areas below. And otherwise, have a great day. Take care. Bye.